Hello and welcome to Connolly Hospital Day Surgery Information video. Here we will provide you with an overview of preparing for your surgery, what to expect on the day of your procedure, and what to expect in your post-op recovery period. Depending on your procedure, you may be asked to attend a nurse-led anaesthetic pre-assessment clinic. Some patients will alternatively be assessed over the phone and given instructions to follow if indicated. The night before your surgery, you will be asked to refrain from eating and drinking from midnight onwards. You may also be asked to stop specific medications which can interfere with the clotting of your blood. However, it is important to check with your doctor before stopping any medications. If you are unable to attend for your procedure, please let us know as far in advance as possible. Connolly Hospital is located just off exit 6 of the M50 at the Blanchardstown exit. There is parking available on site, so please remember to bring enough change. To get to the day ward, enter the hospital through the main doors and take the lift to the 3rd floor. Turn left out of the lift, left again, and continue down the hallway until you reach the surgical day ward. Proceed through the doors and to the reception desk, where you will be greeted by a friendly receptionist who will check you in. You will be allocated a bed and meet the staff looking after you, who will take a medical history, assess your vitals, and perform any tests necessary. Now all that is left is to await your theatre slot and operation.
Laparoscopic cholecystectomy is a general anaesthetic procedure where you remove the gallbladder using keyhole surgery. The first incision is made either above or below the belly button for a camera to be inserted into the abdomen. A second incision is made in the upper abdomen. A third and a fourth incision are then made on the right side of the abdomen. Sometimes it is not safe to proceed with keyhole surgery, and a larger incision on the right-hand side of the abdomen is made. Sometimes, because of severe inflammation, it is not safe to proceed with the operation and it may have to be abandoned. At this point, the gallbladder may be deflated intraoperatively, or you may need to have a tube called a drain inserted into the abdomen. The aim of this is to relieve the inflammation, and the operation will be rescheduled for 6 to 8 weeks later. The gallbladder is a bile-containing organ located under the liver. Once the gallbladder is seen, the tubes highlighted as common bile duct and cystic duct are found. Clips are placed on the cystic duct and a cut is made to separate the gallbladder from the common bile duct. The gallbladder is then removed through one of the incisions. If gallstones are small, they may slip from the gallbladder into the common bile duct during surgery, causing blockage to the flow of bile, thereby causing jaundice. These stones are usually removed through a further endoscopic procedure known as ERCP. It is important to highlight that these ducts are small structures and there is a risk of damage during the operation, especially when there is inflammation or previous surgeries in the area. This happens in less than 1 in 200 patients. If this complication happens, bile will leak into the abdomen or back up to the liver, causing either infection or jaundice. This is a rare complication of the operation, but it's important as it may require further procedures to repair the damage. Other complications of your surgery include infection into the incision sites, bleeding inside the abdomen, also known as a hematoma, damage to other organs inside the abdomen, hernia where the instruments were inserted into the abdomen, also known as port-site hernias. If you have any questions with regards to your procedure, make sure to ask your surgeon. We wish you all the best on the day of your operation.
After your operation, you will wake up in recovery. You may feel drowsy or disoriented, however this is normal after general anaesthetic. Shortly after, a member of the team will come and talk to you about your procedure and answer any questions you may have. Before you are discharged, you will receive your post-op instructions, a prescription if needed, and a letter for work. Some patients will require a follow-up outpatient appointment, and if so, you will be advised of this before you leave. If you do not require an outpatient appointment, you will be given a telephone number to call should you have any questions or concerns during your post-operative period. Thank you for watching. We hope you have a pleasant experience at Connolly Hospital.